In this video, we'll review how to prescribe naloxone for patients that are on prescription opioid medications. It's a fairly straightforward approach, but it's a slightly different framework when working with this population. First, people who use prescription opioid medications, whether they're former substance users or have no history of substance use whatsoever, generally don't perceive themselves at risk of an opioid overdose. Thus, we use different terms like opioid safety and medication safety. And we refer to naloxone as an antidote akin to an epinephrine pen. The other thing is we really try to minimize the stigma that might be associated with a naloxone prescription, because our goal is to get naloxone where the opioids are. Now I'd like to speak with you about naloxone. Have you heard of naloxone?
No, what's that?
So naloxone is an antidote to opioids, like the medications that you take for pain.
Okay.
It reverses the effects of those medications, and so it can reverse any bad effects from opioid medications, like when you stop breathing or you can't be woken up, and in rare cases, people can actually die from these medications.
Is that like an overdose?
Yeah, it is really an overdose, but it doesn't necessarily mean you took too much of the medication. It can happen even if you take the medications as I prescribe them. If you're drinking wine or taking certain other medications along with those opioids, or if your body's too sick and can't handle your usual dose, or if you feel like you need to take an extra pill because you're having a lot of pain, which I don't recommend, but if it ever happens, and if you ever do have a bad reaction like this, I want to make sure that you have at home this antidote.
Okay.
And I also want to make sure it's there in case anybody else ever accesses your opioid medications without your knowledge.
All right, that sounds good.
So there are two formulations. One is injectable, the other is intranasal. The injectable is like a flu shot in the arm. The intranasal is a nasal spray. Which one would you be interested in?
I think the intranasal sounds better for me.
Great. Once we're done here, the nurse will demonstrate how to use the intranasal kit and give you a little package with a brochure, so you have some information about this. And then when you get home, I want to make sure that you talk to someone in your family or someone who lives near you and let them know where the naloxone is and what to do if they ever find you non-responsive and in need of help.
Okay, great, I'll do that.
Do you have any other questions?
I don't think so. Thanks, I'm happy to have the prescription.
Great. One other thing I want to make sure that you know is you can administer this to somebody else if they have an opioid overdose. You're actually protected by state law from any liability if you think someone's overdosing and you give them your naloxone.
Great, that's good to know.